You look at yourself in the mirror and you realize your eyes are red. They're also teary, itchy, and painful. You might have pink eye, also known as conjunctivitis, which is highly contagious. Many of us refer to it as sore eyes. But the term sore eyes can actually mean any number of conditions caused by various factors. Here on Med Talk Health Talk, we'll talk about the different types of sore eyes, what's causing them, and how they can be treated. I'm Dr. Freddy Gomez. You're watching CNN Philippines. Whether it's an infection like conjunctivitis or eye strain from too much screen time, almost everyone has experienced sore eyes at some point. Technically speaking, sore eyes can refer to conditions that cause mild to severe soreness in your eyes. It can take many forms. So how can you tell which type of sore eyes you have? To tell us more about this, we have Dr. Eric Chongson. He's an emergency medicine specialist and consultant at the Asian Hospital Department of Emergency Medicine. We're also joined by Dr. George Ko Jr., an ophthalmologist and eye center director of Chinese General Hospital and Medical Center. Thank you both doctors for joining us here today. Now, when you hear the term sore eyes, a lot of people immediately associate it to pink eye or conjunctivitis because it's very common. And many of you who are watching us may have experienced this at one point or another. But what really happens to the eyes when you have conjunctivitis? Can you answer this first, Dr. George?
Sore eyes can take many forms. So actually, sore eyes, soreness of the eye is, I have a diagram here, okay? This is your eye. So it is enveloped by a thin membrane. And then during sore eyes, this thin membrane becomes swollen. It's red and engorged. The blood vessels are engorged. And there are many causes. No? You can be viral, which takes up about 80% of the causes of conjunctivitis, 20% bacterial. And then there are other causes like you mentioned, Dr. Freddy, from eye strain, digital eye strain from using too much of your gadgets when your eyes get dry. And then there's also allergic conjunctivitis and irritating conjunctivitis from smoke, from dust.
Okay, so ang mas common talaga, Dr. George, viral type of conjunctivitis rather than bacteria. Let's remind our viewers, Doctor, kung ano bang difference ng virus at ng bacteria?
So viral conjunctivitis, well, we are quite familiar at this time, no, because of COVID. It's a viral infection. So it's an infection from, actually, it's not an organism, but it's a RNA particle. And there are also viruses that cause a lot of redness, such as adenovirus during the flu season, the influenza. And then bacterial are caused by bacterial organisms which contaminate the eye. For example, you go swimming. For example, you rubbed your eyes from having contaminated fingers and from contaminated surfaces. Then the allergic is from irritants in the environment.
Okay, that's good that you mentioned the different ways in which these viral and bacterial types of conjunctivitis can be obtained. Dr. Eric, can you explain to our viewers what is the most common way para naikakalat itong sore eyes?
The most common type of conjunctivitis is really the viral type. And as we know right now, as we're dealing with the pandemic, a virus is caused through droplets. So a lot of times, the same way COVID is spread, viral conjunctivitis is spreading the same way. Nowadays, to tell you honestly, in the emergency room, we have seen a dip in the cases of conjunctivitis. Maybe it coincides with the fact that we've been preaching hand hygiene a lot. Viral infection is really spread through airborne particles, and whenever you cough, sneeze, touch something, and then touch your eyes, that's how you get these kind of organisms.
It's good that you mentioned conjunctivitis and how it is spread, and it's similar also viral, just how COVID-19 is. But do we know now, Dr. Eric, is conjunctivitis or ang sore eyes ba ay pwedeng simptomas din ng COVID-19?
Well, that's a very good question, Freddy. The thing with COVID right now is the main symptoms are really respiratory. So if you see a patient purely with complaints pertaining only to the eye, without the respiratory symptoms, without the cough, colds, and fever that comes with COVID infections, then it's the risk of having COVID-19 illness is really high. If they have those illnesses with the conjunctivitis. But if a patient comes in with just purely a pink eye or redness in the eye, itchiness in the eye, without the respiratory symptoms, in all likelihood, this is just purely conjunctivitis, either viral or bacterial.
Okay, very good. Now, the good news is pink eye, more often than not, is rarely serious if treated early. Dr. Ko, what is the proper treatment for conjunctivitis?
The sore eyes, which is viral, usually you just wait it out. You apply a cold compress and then isolation, hygiene, of course, like Dr. Eric said. You have to be very clean. Make sure you do not contaminate other surfaces or other materials that may come in contact with other people. For bacterial, we can use antibiotics, topical or oral treatment if needed. But both is best seen by an ophthalmologist or specialist so that they can determine which is which and what kind of treatment is best.
Ultimately, practicing good hygiene is the secret to preventing pink eye from spreading. Dr. Eric, what are some of the good hygiene habits to help prevent pink eye that you can advise our viewers?
Well, I mean, like I said, it coincides with the pandemic that we have now. Now, basically, if you're doing what you're doing to prevent the acquiring the COVID disease, that's exactly the ways of preventing this illness as well, preventing conjunctivitis. So if you just wash your hands all the time, make sure that you avoid rubbing your eye if you have irritation or pain in the eye. Avoid touching your eye, and that should prevent a lot of the complications associated with conjunctivitis. But again, the mainstay here, I mean, if you just do hand hygiene often and a lot, and you make sure that you clean your hands well, we shouldn't have a problem with conjunctivitis.
And your eyes can also get strained or sore due to overexposure to screens. This is happening a lot these days, especially with our work from home setup, when you're staring at your computer screens all day or your gadgets, or many even spend hours texting away on their phones. We'll discuss this after a short break. We're your connection to healthcare here on MedTalk Health Talk. Stay with us. I'm Dr. Freddy Gomez. Welcome back to MedTalk Health Talk, where your health comes first. Itchy red eyes don't always mean you have pink eye or conjunctivitis. There's also a condition known as digital eye strain or computer eye strain, and this can cause vision as well as eye problems. We'll discuss why this happens and how best to treat it. If you spend too long staring at a screen, more often than not, you'll start to notice dry or your eyes becoming very red, maybe even blurred vision. Dr. George, why does this happen kapag matagal na nakatingin sa screen ng mga tao?
Primarily, at this time, the reason why we get this irritation because we do not blink too much, we stare too long, and then the positioning, the light source from the computer screen might be too bright. It causes strain. And then there's this, what we call the blue light effect. There's a very minimal blue light that comes from our screens, and they cause quite eye strain also, or we say eye fatigue. So there's fatigue when you're looking too long at a certain screen.
Now, Dr. Eric, a lot of people who have this eye strain while staring at their screens, but what type of symptoms should they be wary about that may require more professional care or a visit to the emergency room?
Well, in the beginning, of course, all these things, when you have discomfort in the eye, a little bit of redness in the eye, they all overlap. No, it could be a strain, it could be conjunctivitis, beginning conjunctivitis. But the key here is after, I guess, with eye strain, after you've rested for a while, when you wake up after a nap or after you've rested, you should feel okay. But if it persists, And of course, if, like Dr. George said a while ago, if there's some discharge which could indicate a bacterial infection, it may be time to visit us at the emergency room.
Yes, that's right. So, but for any symptom or any treatment, always consult your emergency room specialist or your ophthalmologist, especially when it comes to your eyes. Now, it isn't just the long hours of screen time that causes eye strain. There are other factors that could be making your vision worse. Dr. Ko, what causes digital eye strain other than spending a long period of time in front of a screen?
If you have not corrected your eye, for example, your glasses that you're wearing is not corrected properly, that could cause eye strain. Okay, not even other than the gadgets. Well, if you're staring too long, no, like paper material that has glare, it causes there's a glare because from a different light source that can also cause eye strain. The contrast of words, no, fonts when you're reading from paper or from the screen, the contrast is not too good, then it can cause also eye strain. Then position, your neck position. That's why it's nice to have your eyes at a certain level, actually looking down a bit. And then of course, if you get dry eyes from looking on too long, then that could also cause eye strain and blurry vision.
The best way to relieve your digital eye strain is to limit your screen time. Now, we understand that sometimes this isn't possible or very difficult to do. So to improve your eye strain, you need new screen habits. Dr. George, what good habits can you share with our viewers when it comes to less chances of eye strain?
Yeah, so this is very important. There's this 20-20-20 rule. So this is quite common knowledge for a lot. Our society has been promoting the 20-20 rule. No? So if you look at your screen or you're reading at about for 20 minutes, you take 20-second rest and look at an object or something else at 20 feet away during that 20-second rest. So that can relieve your eye of the eye strain. Of course, maximum hours for using the digital gadget would be 2 hours, and then you have to take probably half an hour rest after.
As Dr. George mentioned, the recommended 20-20 rule, where you have every 20 minutes, look at something 20 feet away for 20 seconds. Very good advice. Now, Dr. Eric, other than these eye strains that can cause redness, another thing is allergies naman. So could you explain to our viewers what to expect kapag allergies naman ang cause ng kanilang eye redness?
It's very, very difficult to determine whether you're dealing with an allergic reaction, the cause of conjunctivitis, and a viral cause, no? Because at the beginning, the presentation is really similar. Of course, allergic conjunctivitis, there's a triggering point, meaning you inhale something, you expose yourself to something, to a certain allergen like pollen or maybe dust. Then all of a sudden you develop sudden onset irritation in the eyes, redness in the eyes, and tearing. No? So if that happens, then in all probability you're dealing with just allergic conjunctivitis. But like I said, like what Dr. Ko was saying a while ago, if it's a prolonged thing and you've taken yourself away from the source of allergy already or the trigger, and the symptoms persist, then probably you're either dealing here with a viral or potentially dealing with a bacterial, a beginning bacterial conjunctivitis. But if there's a trigger and you can eliminate that trigger and it stops, then probably in all probability it's just allergic conjunctivitis.
So, Dr. Eric, in this time, pandemic is around, and as much as possible, people don't want to overwhelm the ER. What could you give tips for our viewers on what to do as first aid if ever they feel something bad?
Yes, that's a very good question, Freddie. Because as you know, right now, all the ERs in the metropolis are overwhelmed because of the COVID situation. And really, if you go to the ER with the itchy eye or a red eye, one thing is guaranteed, that you will wait. You will wait. Now, if you can wait that long, then obviously it's okay. But you also run the risk of getting something from the emergency room if you're there unnecessarily. So basically, the symptoms that you are looking at here is if you have eye symptoms or pain associated with the irritation, then you have to go to the emergency room, because there are many other causes of eye problems that will present as pain. But if it's very painful, then you go there. But in general, I think Dr. Ko will agree with me here. as long as you don't scratch your eye or rub your eye, you can actually wait the following day, because we defer to the ophthalmologist. No? We defer to them as far as the eye is concerned. They're the experts. So if you can wait the following day and set a consult with them, they would be the best people to handle your problem. But again, sometimes in the middle of the night, some people have a low tolerance and will really have to come to the ER. Just make sure that if you feel like there's something bothersome there's some pain there. Like I said, pain is the number one thing that you're looking for. If there's pain, then go to the ER so we can check you out. At least we can avoid potentially serious complications or problems.
Regardless of whether you have pink eye, allergies, or digital eye strain, keeping your eyes healthy is a must. We'll go through the ways after a short break. This is Med Talk Health Talk on CNN Philippines. It's easy to take your eyes' health for granted, but with overexposure to screens nowadays and other possible causes of sore eyes, there are things you can do to care for your eyes and ultimately improve your overall well-being. I'm Dr. Freddy Gomez. You're watching Med Talk Health Talk on CNN Philippines. Our eyes are very delicate and complex, and nutrition plays a key role in keeping them healthy. For example, many say carrots are a good source for eye health. Now, Dr. Eric, what types of food can you recommend to our viewers that can help improve their eye health?
Vitamins like vitamin C help a lot as far as the nutrition of the eye. Zinc, I know, is a nutrient that is very important as far as the eye is concerned. You know, if you take your multivitamins every day, take your leafy vegetables, leafy green vegetables, and like you mentioned a while ago, carrots. If you eat healthy, a balanced diet, I think it'll follow that your eye will also be healthy.
Very good. Now, Dr. George, on to you. What kind of tips can you give our viewers when it comes to overall eye health?
Aside from vitamin C, another good vitamin that we should not forget is vitamin A and E, and the omega-3, the fatty acids, which are present in fish. Also, fruits and vegetables are also rich with vitamins that can help our eyes. And what's more important is enough rest, enough sleep. So sleeping is also important because that's the time when you can rest your eyes. And of course, adherence to the protocol of not using too much of your eye and your gadgets and taking long periods of break and rest.
Okay, now I want to talk quickly about dry eyes naman, because if your eyes are dry and dehydrated, your vision can also be affected. Plus, you would be feeling very uncomfortable. Dr. George, what are some of the symptoms ng dry eyes?
Okay, so dry eye is quite common nowadays because of the digital eye strain. It comes with using your gadgets too much. So dry eye is a condition wherein the tear production may not be enough, or the evaporation of your tears is quite fast, so it leaves your eye dry, leaves your eye blurry. There are some gritty sensation. Usually happens early morning when you wake up or during the time that you're using your gadgets. When you don't blink too much, then the eyes begin to strain, and sometimes, of course, it gets red. Quite common also with people, older people, and also quite common with people past menopause, hormonal changes. If you're taking anti-allergy medications, that's also quite common that you get dry eyes.
Now, if you experience unusual problems that are causing pain or discomfort, such as itchiness, or your vision is affected, go see your doctor. Thank you, emergency medicine specialist Dr. Eric Chongson and our ophthalmologist, Dr. George Ko Jr. We appreciate your time very much. We're here to help build a healthier future for you. I'm Dr. Freddy Gomez, and thank you for watching Med Talk Health Talk, only on CNN Philippines.